All right. I know I'm starting to see different folks come in, and please make sure to not put any identifiable information in the chat as well. Just part of some of our training rules and operating procedures. But getting started, so I know we have a full agenda today. Just a quick moment of housekeeping. We want questions. We'll have time for question and answer later on, but please use the Q&A button to ask any questions. We'll be monitoring that. And again, towards the end of our presentation, we'll have time for that. This session is also being recorded. We will share this session and the slides out afterwards via email. So if you register, you'll be able to get access to them moving forward. Later in the presentation, you'll hear from Maggie Flowers, SHIP Program Manager of the Administration for Community Living. She'll be joining us a little bit later to talk about the SHIPs and ways that you all can get involved and learn more from them. But it's my pleasure and honor to pass it over to Tricia San Diego, Senior Advisor for the Caregiving and Health Team at AARP, to present the main part of the presentation today. So Tricia, over to you.
Thanks, Colin, and thanks everyone for joining and for introducing yourself in the chat. Seems like we have an audience from all over the US today. So thank you for joining from wherever you are. Today's session is Medicare 101 for your business and your eligible employees. I'm Tricia San Diego, Senior Advisor on AARP's Family Caregiving and Health Team. Public health is my background. I am a certified health education specialist, and I do a lot of these sort of speaking engagements around topics on caregiving and Medicare. Today's session is going to be about Medicare 101, and what we're going to cover is on your screen. First, we're going to start off with the Medicare basics. It's really important to kind of get that fundamental basic knowledge of Medicare because it can get confusing and complex very quickly. Then we're going to talk about how you can educate your employees on Medicare. And then we'll go over a list of key resources and tools with our SHIPs being one of them. Next slide. So some common questions that we hear often when it comes to Medicare is, what is Medicare? What is covered with Medicare? Ones that relate to employer-sponsored health plans are things that come up. We get questions about when they should enroll, what happens if you don't enroll, because there are penalties. How will my Medicare work with existing healthcare? We'll include some guidance on how to educate and engage with employees around Medicare in today's session. Next slide. As more and more employees continue to work past a typical retirement age, employers are more likely to have Medicare eligible employees on the payroll and participating in their employee health benefit plans. If you've not already been asked questions about Medicare, you likely will in the future as more and more people continue to work past the age of 65. As a business owner, your role is to provide information, connect employees with resources, and help them avoid penalties. The transition to Medicare can be a confusing process, so employees may need extra support. We know employers, especially small businesses, care about the well-being of their employees. Helping equip them with information and resources to make informed decisions is the best defense against enrollment penalties. So you'd be saving your staff money as they're making their Medicare choices and decisions. This presentation aims to educate you on all you need to know about Medicare and how to engage with your employees. Next slide. So first and foremost, let's start with the very basics. What is Medicare? It's a federal health insurance program for people age 65 and over. It's also for some younger people with certain disabilities, and it's for people with permanent disabilities, end-stage renal disease, and people with ALS, which is also known as Lou Gehrig's disease. Next slide. So let's go over some definitions, and these are going to be insurance terminology that also apply to Medicare, and it's really good to kind of get a refresher if you already know what these are, so that you understand a breakdown of the different types of out-of-pocket costs that can come from the consumer. Like most other insurance, Medicare does not pay for all of your healthcare costs. People are responsible for paying for the costs that are not covered, such as you see here, your monthly premiums, your deductibles, your co-insurance, and your co-payments. Your premium is the monthly amount an individual would pay to Medicare or a private insurance plan for an individual's healthcare and prescription drug coverage. It's that monthly amount that you have to pay for that coverage. A deductible is the amount an individual would owe for healthcare services that the health plan covers before your health plan begins to pay. The deductible may not apply to all services. So that's that sort of threshold amount that you need to reach before a lot of the insurance coverage and benefits kick in. Coinsurance is the amount an individual may be required to pay as a share of the cost for services after they pay any deductibles. Coinsurance is usually expressed as a percentage. Usually insurance will cover 80% and you're responsible for, let's say, 20%. Co-payment is the fixed amount an individual would pay for a covered health care service, usually when they receive the service. The amount can vary by the type of covered healthcare service. An example would be a co-payment if you visit your doctor's office or a specialist or a urgent care clinic. There's different sort of co-pay amounts for that, and that's part of the cost sharing. Next slide. What does Medicare not cover? This is a question that's just as important as what it does cover. And it's surprising to some people, but Medicare does not pay for vision, dental care in most cases, hearing, or long-term care, such as an extended stay in a nursing home. Medicare Advantage plans may cover these, and we'll talk about what Medicare Advantage plans are, but generally, original Medicare does not. The fact that Medicare does not cover long-term care services specifically can be a surprise to a lot of people. Medicare only helps cover certain services if they are medically necessary, but it does not cover custodial care. These are things that are assistance that you get for activities of daily living, such as bathing, eating, dressing, and toileting. Next slide. So now we'll go to the different parts of Medicare. You know what the program is, how it works, and what it doesn't cover. We're going to go through the basics of the different parts, and it's a little bit of an alphabet soup. You may have heard about parts A, B, C, and D, but let's break it down and start with part A. Part A covers hospital insurance. It helps cover inpatient hospital care, some home health, hospice care, and some skilled nursing facility care. Let's go to costs next. The costs for Part A, most people who qualify for Medicare do not pay a premium for Part A because you already paid for it through payroll taxes while working. If you do not have premium-free Part A, you may still be able to buy it under certain conditions. Part A has coinsurance in addition to deductible. There is a deductible of $1,600 in 2023 for inpatient costs for each benefit period. The benefit period ends when you have not gotten any inpatient hospital care or skilled care in a skilled nursing facility for 60 days in a row. If you go into a hospital or a skilled nursing facility after one benefit period has ended, a new benefit period begins. So that's Part A, and that's the costs, and it's all about hospital coverage. Part B is going to be medical insurance. This is going to help cover things like a portion of the costs for doctor visits. It's going to cover outpatient hospital services, durable medical equipment such as wheelchairs, hospital beds, walkers, for example. It covers rehabilitation therapy, laboratory tests, X-rays, mental health services, and some preventive services to help maintain your health and detect problems early when they are at a more treatable stage. Going on to the costs for Part B, if an individual enrolled in 2023 has original Medicare, their premiums are going to be $164.90 per month. Those with higher incomes, they actually have a higher premium. Individuals earning more than $97,000 a year or couples earning more than $194,000 a year, you will pay a sort of income-related adjusted extra amount. The annual deductible for Part B in 2023 is $226, and the coinsurance is 20% for most services. Next slide. Let's go to Part C. Part C is known as Medicare Advantage. It's actually not really sort of a subpart to Original Medicare. It's an entirely different alternative to Original Medicare. Medicare Advantage are plans that are alternatives to Original Medicare. They're plans offered by private insurance companies. They are provided by Medicare-approved private insurance companies. And all plans must include hospital and medical coverage. So they're going to include parts A and B. And in most cases, they will cover prescription drug coverage, which is known as Part D. By having a Medicare Advantage plan, that may limit your ability to purchase Medigap in the future. Medigap is something we'll talk about, and that's called a supplemental plan. And those are only things that you can purchase if you have Original Medicare. So that's why we have that point here in Part C. Next slide. How does Medicare Advantage work? So as you know, it's an alternative option to Original Medicare. The plans, Medicare Advantage plans, are available in most parts of the US, but you must live in the plan's area to receive services. You must choose from the plans available in your area and sign up directly. Medicare Advantage plans pay for the same healthcare services as Original Medicare, but they might also pay for additional healthcare services. So the things that I said were not covered by Medicare, sometimes Medicare Advantage plans do cover it. Things like vision, hearing, and dental. In most Medicare Advantage plans, you can only go to doctors, specialists, and hospitals on the plan's provider list. And plans may limit coverage or provide no coverage for out-of-network providers. So that is sort of one thing to consider when shopping for a Medicare Advantage plan, is that network of providers. You also have to follow the insurance company's rules. For example, they may require you see a referral for certain services or to see specialists. And so that's something that you have to make sure that you get and you keep track of before you take advantage of the services. Make sure you understand how the Medicare Advantage plan works before you join so that you're clear on sort of all those rules. Next slide. Let's go to Part D. Part D stands for drug coverage. I think that's the easiest for me to remember, prescription drug coverage. Part D helps cover some of the costs of prescription drugs that an individual picks up at the pharmacy. Part D plans are run by Medicare-approved private insurance companies. To get Medicare prescription drug coverage, you must join a plan run by an insurance company that is approved by Medicare. If an individual is eligible to join but do not, there could be a late enrollment penalty. Medicare Part D is provided by standalone Medicare prescription drug plans, plans that offer drug coverage only. And they also, as I mentioned, may be included in Medicare Advantage plans that offer coverage for both prescription drugs and healthcare. Next slide. We'll go to costs. For Medicare Part D, the benefits and costs vary among plans. There's typically a monthly premium, deductibles, and co-payments associated with Part D, unless you qualify for assistance paying for these costs. As with Part B, premiums for Part D are higher for individuals earning more than $97,000 a year for individuals, or for couples earning more than $194,000 a year. For 2023, the standard benefit for Medicare Part D includes a $505 annual deductible. After meeting the deductible, you're responsible for 25% of your covered Part D prescription drug costs until you reach an initial sort of coverage limit, which in 2023 is $4,660. Okay, so I think we covered the main parts, the main letters, and now we just want to kind of recap how the Original Medicare and the alternative to Original Medicare, which is Part C or Medicare Advantage, works. So you have these two main options, and this is one of the main decisions that you have to make when you're enrolling in Medicare for the first time. So whether this be for yourself, for a loved one, or if you're hoping to learn more about Medicare to help educate your employees as they make their Medicare enrollment decisions, this is one sort of critical piece. That's that there's two main options on how one can get their Medicare coverage. There's Original Medicare, Sometimes it's referred to as traditional Medicare. If you have original Medicare, which is parts A and B, and if you want prescription drug coverage, you have to join a Medicare prescription drug plan, Part D. So you have to actually shop around and find a prescription drug plan that works for you. One that maybe covers your drugs, one that, is in the price range you're looking for. You have to kind of shop around and choose what's best for you. If you don't join Part D initially when you first sign up for Medicare, and you don't have drug coverage but want to join later, you can incur a fee or a penalty by doing that. Medicare Advantage is the other option. It's also known as Part C. These are run by the private insurance companies, and they typically include parts A, B, and D all under one plan. So I love sharing an anecdote or an analogy rather that a mentor once taught me when I was first trying to learn Medicare. Think about restaurant week. Medicare is like that in the sense that you can go to any regular restaurant that, let's say, they don't participate in restaurant week, and you're ordering your different things. Your appetizer, let's say, is part A, your part B is an entree, and then you have dessert is part D, and it's sort of a la carte. If you were then going with Part C, which is like Medicare Advantage, and you're going with like a fixed price menu, you have a little bit less options in each category. Let's say there's certain limitations, right? But then you have this sort of fixed price. There's might be some conveniences there because it's sort of all in one. That's kind of the main difference there, is that one is kind of a la carte and one is sort of all under one umbrella. But you have to kind of choose what's best for you, because it's all dependent on individual lifestyle factors. Next slide. Let's dig a little bit deeper into original Medicare. So that's sort of your a la carte. That's a fee-for-service health plan. It consists of both parts A and B, and it covers many, but not all, of your healthcare costs. It generally pays about 80% of your covered medical costs after you pay your Part B deductible. Because Medicare does not cover all your healthcare costs, some people consider buying a Medigap policy. That's that supplemental plan that I mentioned. You can only get a Medigap policy if you have original Medicare. We will discuss these plans in just a few moments. People with original Medicare can go to any doctor, hospital, or healthcare provider who accepts Medicare, which includes about 95% of physicians. So always be sure to ask your healthcare provider if you want to stick to the one that you already have, if they accept Medicare, and most likely they will accept the original Medicare if that's the route that you're going. If you're shopping around for new doctors, be sure, even though a doctor may accept Medicare, they may not be accepting new patients at the time. So that's another thing to kind of consider when you're switching providers. If you have original Medicare and you want to get Medicare prescription drug coverage, you must choose, shop around, and join a Medicare Part D prescription drug plan. So that's something you actively have to take part in enrolling. Next slide. When do employees enroll in Medicare? That's one of the most common questions that we get, and there's many different terms and timelines, so it can get unclear for people to know when and how they should sign up. If employees do not sign up for Medicare during the appropriate window, they may encounter a penalty. So this is where you can come into play as an employer. Purely from an educational standpoint, you're not advising them on sort of which plan to buy or which direction they should take. You're really just helping them in terms of reminding them when to enroll and pointing them to referral resources where they can learn more information about it so they can make the best decision. Otherwise, they can incur a penalty if they don't enroll at the right time. Next slide. So here are the different enrollment periods that are available. There's initial enrollment period, the special enrollment period, and an annual open enrollment period. And we'll go through each one. Initial enrollment, that is your period. Next slide. Initial enrollment, if individuals are already receiving Social Security at the age of 65 individuals will actually be automatically enrolled in both parts A and B. So that's if you claimed your Social Security a little bit early and you're already receiving Social Security benefits, you'll be automatically enrolled. I always suggest follow up and call Medicare Social Security Administration as well, just to make sure if you didn't get sort of confirmation or a letter. Employees enrolled during a 7-month period called the initial enrollment period, and that's based around their birth month, the months that they turn 65. So you have the 3 months before the month of your 65th birthday to enroll, which I think is actually the best time to enroll, those 3 months, to avoid any sort of coverage gaps, and so that you don't forget and wait last minute. The 3 months before you turn 60, before the month you turn 65, the month of your 65th birthday, and then the 3 months after the month of your 65th birthday. So altogether, you have those 7 months, and that is what makes up the initial enrollment period. If you don't enroll in parts B and D when you are eligible, you may face financial penalties later when you do enroll, when you do decide that you need it. You may then be stuck with these penalties. Employees with coverage through an employer or spouse's employer plan are exempt from any penalties if you work for a certain size company. So there's a lot of different nuances and rules to remember when it comes to that, but you really want to avoid the late enrollment penalty. Next slide. So what is the special enrollment period? For those employees who are going to continue to work and are going to be able to continue to use their existing healthcare coverage that's offered through your company, through your organization, then there is a special enrollment period for them so that they can enroll later. If an employee does not enroll during initial enrollment for an exempt reason, this would be such, they will be able to enroll in Medicare during special enrollment. Employees who lose employer-based coverage, for example, if they retire, they have 8 months from losing that coverage to enroll in Medicare without a penalty. So that's an 8-month window for special enrollment. After 8 months, these employees may face a penalty. Employees who missed initial enrollment for no exempt reason can enroll in a general enrollment period at the start of each calendar year. However, those employees will most likely incur a penalty when enrolling during general enrollment. So it's not like even if you miss your special enrollment period, you're never going to be able to join. You will be able to join Medicare, but just know that you will incur a penalty if you didn't enroll when you should have. Or if you didn't enroll and don't have an exempt reason, such as you're continuing to be covered through your employer plan. Next slide. So I'll talk about the open enrollment period, which is actually an enrollment period that's not for people enrolling in Medicare for the first time. There might be overlap if you have sort of a fall timeframe birthday or later in the year, because open enrollment is an annual period that happens every year from October 15th through December 7th. This period is for existing Medicare enrollees. It is the time when existing Medicare enrollees can make changes to your plan. So once an individual, including a working employee, is enrolled in Medicare, you can always adjust your coverage annually during this time period, which is, again, October 15th through December 7th. However, employees who missed initial or special enrollment cannot enroll during open enrollment and must enroll during general enrollment. So lots of different timeframes for Medicare, but just think of the annual open enrollment period as similar to one that you may already offer for your existing health insurance coverage plans. You usually have benefits open enrollment every year, and this is basically what Medicare is. It's the opportunity to make changes and be able to kind of review your existing coverage and if there's something else available that you want to go for and there's different options, and you can kind of choose and shop around then. So you're not kind of stuck in the Medicare plan that you choose from the very first time you sign up. You're not committed to that forever. If you decide you want to change, Medicare open enrollment is your time to do that. Next slide. Let's talk about these penalties. So I mentioned the penalties as being really one of the major things that you want to avoid if you're, joining this session, trying to learn about Medicare for yourself. You want to help your loved ones avoid it. If you're a caregiver for a loved one and you're trying to help them navigate Medicare, or if this is for your employees, you really want what's best for them in terms of financial security, and could play a really helpful, important role in reminding them of the important times to enroll and avoid these penalties. Because in addition to gaps in coverage, which you want to avoid, these penalties are another major thing that you want to avoid. So one of your crucial roles is to help avoid these penalties. Listed here are the penalties for each part of Medicare. There are no late enrollment penalties associated with Part C because Part C is voluntary. I want to call your attention to Part B in particular, as this penalty is locked in for the remainder of someone's life. These penalties can have a dramatic impact on one's healthcare and their healthcare costs, which is why employers need to be thoughtful of the way they educate and engage their employees. It's the right thing to do. It's added support and help, and hopefully not a big lift for you, because we're not asking you to be sort of Medicare experts or advisors by any means. It's really just a nudge to encourage your employees to enroll when they should, so that they can avoid these penalties. Part A's penalty is up to 10% increase for monthly premiums for twice the number of years not signed up that you could have been signed up. For Part B, it's a 10% increase for monthly premiums for each 12-month period not signed up. The penalty will stick for as long as you have Part B coverage. Part D, so this is Part B is the one that I said it's for life. You're going to have that increased premium for life. Part D is calculated by multiplying 1% times the national base beneficiary premium, sort of the average cost individuals pay per month on prescription drug premiums. In 2023, it was $32.74. So you take 1% times that, times the number of full uncovered months you didn't have Part D or creditable coverage, but could have. So that can get confusing, but just know those are the penalties you want to avoid. And hopefully you'll never have to kind of calculate this, but it does add up if it is something that you do have to incur because you missed a deadline. So these are things that we want to prevent. Next slide. So let's talk about Medicare and your business. Now that you have some familiarity with Medicare as a program, the rest of the session is focused on what you can do, what you can do for your business and how to educate your employees. Next slide. Let's point out one real major important thing to be aware of is that employer size does determine Medicare requirements. How Medicare interacts with existing employer coverage is determined by employer size. For large employers, the work-based coverage is the primary payer, with Medicare then providing secondary coverage. For small employers, it's the opposite. Some employees may not know how many employees work at your company, so be sure to indicate to your employees whether or not your business is classified as small. That's going to be fewer than 20 employees. Since Medicare is the primary payer for those companies, for those small employers with 20 or less employees, employees at these small employers must sign up for Medicare or they'll have a gap in benefits. Because of the fact with small employers that Medicare is primary, and if they still offer the employer plan becomes secondary. That employer secondary plan won't pay anything towards healthcare costs unless Medicare pays first. And so you will end up having this sort of gap in coverage and have more increased costs if employees work for a small business and don't sign up for Medicare when they needed to. So it's a little bit more, I think, pressing for working at a smaller company. Large employers, it's the opposite. Medicare pays secondary, and employees will continue with their health coverage that they get through work, and that's primary. Next slide. Just remember that magic number of 20 employees. So here's some common scenarios. Since Medicare is the primary payer for small employers and failure to enroll may result in uncovered medical expenses, the vast majority of employees will enroll in Parts A and B during their initial enrollment period. Let's recap. What's the initial enrollment period? That's going to be that 7-month window that revolves around the month of the 65th birthday. The 3 months before this, the month of the 65th birthday, the month of the 65th birthday, and the 3 months after. For large employers, these 3 scenarios are the most likely to occur. So I'm looking on the right-hand side of the screen. There's scenario 1 where you can enroll in Parts A and B during initial enrollment. There's scenario 2 where you enroll in Part A during initial enrollment, but you delay Part B since you want to kind of, if you want to avoid, having to pay for Medicare already when you already have an employer-based plan. And you assume this employee is still covered by an employer plan, and you do this until enrollment during a special enrollment period. So they would be in scenario 2 where they have Part A, but they delay Part B, and they'll sign up for Part B when they're eligible during their 8-month special enrollment period, which would be triggered by the time when they lose their coverage. For example, if they retire. Scenario 3 would be you delay Medicare Parts A and B enrollment until that special enrollment period. Most people will just go ahead and take advantage of Part A since most people have paid into Part A already and it's premium free. So might as well sort of get that extra coverage. Whereas Part B is the one where you would, if you were already eligible for Part A, Part B is one where you would end up having to pay an additional premium if you decide to enroll in Medicare while you still already have your employer-based plan and you're continuing to work. Next slide. Here's an example of an communication education timeline that can help you kind of keep track of the best times to remind/nudge employees of when their eligibility for Medicare may be approaching. We recommend that you plan to send out approximately 4 communications to your employees in advance of their 65th birthday. The first communication should be a general primer about 6 months in advance of their birth month. In this letter, be sure to discuss the basics of Medicare and what they should expect during initial enrollment. 6 months out, there may be a lot of people who still aren't familiar with the basics of Medicare. You can be 6 months in and still not know the basics of Medicare. So it's really helpful just to kind of get this overview, get this nuts and bolts of Medicare, and to get their sort of wheels moving in terms of, I guess I should start looking into this and deciding which option I'm going to take. As soon as initial enrollment period ends, send the second communication with educational materials. This could include resources from third-party organizations. AARP does have a large number of free consumer Medicare information, but then there's other organizations as well, which you'll learn about. Medicare.gov, of course, is another main source of information to point people to. During their birthday month, be sure to share a list of these resources again, where they can get guidance. There are a lot of insurance brokers who spend the day trying to kind of talk to new Medicare enrollees, and oftentimes people get bombarded around their 65th birthday around these sort of solicitors in lots of ways. And it's hard to kind of decipher who's a credible source of information versus who's selling me something versus who could be a scam. And so there is that variation in quality and credibility. So there's a lot of caution around the 65th birthday because you do get bombarded by a lot of Medicare communication. But we're providing sort of lists of resources of third-party, credible, unbiased sources of information that I think would be the best resources to point people to. A month before initial enrollment closes, it's sort of like one last chance, before you incur these penalties, before they get coverage gaps. Here's materials and more, referrals and resources to take people to. A final letter letting them know that they have a month left before they begin receiving penalties. As an employer, you have a responsibility to help educate your employees. It's not something that's required, but I think it's just something that's nice to do to help your employee well-being and to prevent them from having to have more out-of-pocket costs that could have been prevented, and also to avoid those coverage gaps. It can be confusing and frustrating to many, so extra supports are always encouraged. And hopefully it's, again, not a big lift for you. Next slide. Finally, our recommendations on how best to engage your employees around Medicare are threefold. It's all about providing this clear and consistent communication. You're only communicating about Medicare enrollment. It's not trying to push anyone towards retirement or trying to do anything. You're just reminding them that their 65th birthday is around the corner, or if they have chosen and selected that they're retiring soon, and that's another opportunity for you to let them know about that special enrollment window for Medicare, to avoid penalties then. So it's really just clear and concise information, just reminding them and nudging them about these initial enrollment deadlines and what rules sort of apply to them based on that employer size. Only refer employees to those trusted sources of information. Like I told you, people get bombarded by all types of scammers and fraudulent organizations. And then there's also brokers who are trying to sell products during this time. And so it's really hard to distinguish who's new and who's not. I will say, Medicare and the Social Security Administration are most likely never going to be calling you when it's your birthday to remind you to enroll or to remind, your employees that, so that they're most likely not going to be credible calls, because Medicare and Social Security is not really going to be calling you. They almost always will send a letter instead. So make sure you point people to credible, trustworthy sources of reliable Medicare information. Also, before employees turn 65, educate them about the program and what the transition could look like, because there is going to be some changes. The employer-based coverage might be different from what Medicare offers. If you're going to continue to have both, there's coordination of benefits that kind of need to come into play, and that will impact sort of the costs that come out of pocket. And so it's a transition period, and sort of give them a heads up if they're going to continue to work and have Medicare or their employer-based plan. Excuse me. Next slide. Let's go over the resources. I kept talking about the credible resources. Medicare.gov is certainly one main one. Medicare.gov is where you can do things like sort of shop and look and compare plans. You can also call Medicare at 1-800-633-4227. And CMS is the Centers for Medicare and Medicaid Services. They're the official government agency on Medicare and Medicaid. But the website is very user-friendly, and it's a great place to start. And you can always point people to Medicare.gov. If there's very specific questions about choices of plans, or a more complex sort of individual situation, you can't find it online, or you need to talk through it with someone, we're going to introduce you to Maggie, who will talk about the SHIPs. The SHIPs are another great resource. And I think that might be on our next slide. Yes, we have on the right the SHIPs, and their website is shiphelp.org. Maggie Flowers is joining us today. We're very lucky to have her, who will describe it more. But before that, I'll also just share another nonprofit. Medicare Right Center is another organization who you can turn to for more information. They focus a little bit more on, I think, advocacy, but their phone number and their website is right there, medicarerights.org. But Maggie, take it away. Let's talk about the SHIPs.
Thank you. Happy to be here today. I'm Maggie Flowers. I'm the SHIP and MIPA program manager, and I work at the Administration for Community Living. The Administration for Community Living is a division of the Department of Health and Human Services federally, and we manage the State Health Insurance Assistance Program, or SHIP. ACL was created around the fundamental principle that all people, regardless of age or disability, should be able to live independently and fully participate in their communities. We use person-centered approach to services, offering a range of community-based services through a network of state and local partners. Our programs help older adults and people with disabilities find supports and services that they need so that they can successfully live in their communities. These services include things like Medicare education and counseling, like today's event, meals at home or in community centers, activities at senior centers, transportation. The list goes on and on. You can learn more about the full range of services offered by ACL at acl.gov. Next slide, please. So the SHIP specifically is what I work on and what I want to share with you all today. Tricia has mentioned some about them, but the State Health Insurance Assistance Program, or SHIP, is a community-based network of counselors who provide assistance in person and by phone and make group education presentations and use a variety of media sources to help educate people about Medicare. It is a national program that offers one-on-one assistance, counseling, and education to help folks make informed decisions about their care and benefits. We have 54 SHIP grantees, one in all 50 states, Puerto Rico, Guam, and the District of Columbia, as well as the US Virgin Island. Services are delivered by either the state units on aging or departments of insurance in partnership with their local area agencies on aging and other community-based partners. Nationally, SHIP is a network of 2,200 local sites and over 12,000 team members, many of whom are volunteers and giving their time to help people understand their Medicare options. In addition to SHIP services, many of our grantees also provide the Senior Medicare Patrol Program, which helps Medicare beneficiaries protect, detect, and report healthcare fraud, errors, and abuse. Next slide, please. So how do you find your local SHIP? Well, you go to the number here or the website listed. That number is 877-839-2675 or shiphelp.org. That's shiphelp.org. That is a website managed by our grantee, the SHIP Technical Assistance Center, and they serve as a central source of information for our grantees, but also host the SHIP locator that will get you to your state SHIP and help you partner in your community on education and counseling where appropriate. And the next slide, I think that's it from me.
Thanks so much, Maggie. The information that the SHIPs provide and ACL is so helpful. I have personal testimonial of using their services because Medicare again can get very complex very quickly, and so what I really enjoy about SHIPs is the phone number. Sometimes you just want to kind of talk through a situation because there's a lot of details and context that you need to provide, and they're so knowledgeable. So thanks for joining us, and thanks for sharing a resource, a trusted, reliable, unbiased resource that I think is a great place to point your staff to, yourself to, your loved ones to if you need help. AARP, of course, is another one that I'm going to recommend. AARP, we are a nonprofit, and this educational session is purely from our social mission arm of our organization. And we focus on helping people feel empowered to choose how they live as they age, and making Medicare choices and having Medicare coverage, I think, is an important aspect of aging, and we want to be able to support. We have a ton of resources on our Medicare Resource Center online that's available at aarp.org/Medicare. We also have a fairly new tool called AARP's Medicare Enrollment Guide. It's a digital tool that we have done a ton of consumer testing around to make sure that it is user-friendly and digestible and easy to understand. And so we really recommend you encourage people to go to this website so that they can learn more. I'm sorry, my phone's not stopping. To learn more about Medicare enrollment. This is all about sort of enrolling for the first time, and it's a step-by-step guide, and it'll kind of choose your own adventure in so many ways. And so aarp.org/learn Medicare is our Medicare enrollment guide tool, and it really helps boil down Medicare in a way that's easy to understand, but yet can still be customized to your situation. Check that out. We have another website called aarp.org/Medicare employer. That's the next slide. And this is where all of our webinars are housed. So these are going to be upcoming as well as on-demand webinars and videos, all helpful information on Medicare. You're welcome to share these resources to your staff and your employees about various topics that we have. Sometimes they're upcoming, we have them throughout the year, and then other times if you missed it, no problem, you still just register and then you can view them on demand and share them, maybe even have a viewing party with your staff. So in conclusion, what did we cover today? Well, first of all, thank you for joining and taking the time to learn more about Medicare. I know it can be a lot, but I think with the right tools and information, you can feel empowered to sort of know what to do with your situation and feel confident enough to be able to share important information with your staff, with your employees. We discussed the different parts of Medicare, which is part of the basics, how they work, what costs you can expect. We reviewed the role that you can play as a business owner. I hope you found this information useful to continue learning. Consider these next steps. Visit Medicare.gov or call them at the number from the previous slide. Check out your SHIPs at shiphelp.org. Explore resources available to you through AARP. Use these resources and share them with your staff. Again, we're not asking you to become Medicare experts necessarily. If you're not already, some of you may know more about Medicare than myself, but you certainly don't want to provide counseling or advice if you're not, don't have the credentials to do so, because you don't want to provide the wrong advice to someone when it comes to Medicare. You want to point them to where they can get the most information and where they can help make their decisions for their enrollment. So you don't want to really sort of prescribe a solution for someone if you're not fully aware of all the nuances of Medicare. It's really important that they can talk to an expert who knows a little bit more of that. The SHIPs are certainly one of those. AARP.org, we have a lot of resources as well. But hopefully it's not too big of a lift and you feel equipped to be able to speak more with your employees about this. And on that note, I will ask a few questions before we go to Q&A. It's sort of my turn to ask you questions in a quick poll. Speaking of, sort of how helpful was the session? We're always open to your feedback. If you have open-ended comments that you'd want to make, feel free to drop them in the chat. Let us know how we can improve the session, any additional topics you're interested in. But please take us a few seconds just to complete our quick poll, and then I'll turn it over to you all and try to answer the questions that you've asked. But thanks again for joining. I will say one way that you can help educate your employees around Medicare is to offer a Medicare 101 virtual workshop, similar to one that we have just now with you all. If you want to offer something similar to your employees, like a lunch and learn session or a Q&A type of thing, happy to provide that Medicare 101 knowledge and sort of basics workshop to your staff. Please reach out to us. Colin, if you want to drop that in, or I can drop in a link soon, and you can shoot us an email if you're interested in us doing that. Happy to do that, maybe even in conjunction with Maggie and team at some point. Happy to do those educational sessions to your staff so that they hear all this information that we're providing you. If that's something that will help make your jobs easier when it comes to educating, we're always open to doing these live virtual workshops on Medicare 101. So let's turn to questions. Colin, what do we have?
Oh my gosh, Trisha, thank you so much. I mean, this has just been so fantastic, as it always is. And then we just have a ton of really great questions, and we're excited to kind of dig in. The first one from Sean asks, what type of resources are available for people who need long-term care but not able to afford it? So not necessarily focus on Medicare, but if there's places that you would direct them to go and look at or evaluate, I think people will be interested in hearing about that.
Yeah, that's a really good question. And I also wear sort of a caregiving education hat as well. And it's good that you sort of caught on that. Yeah, Medicare doesn't cover typical sort of long-term care costs. That is something that Medicaid might be able to cover in your state if your loved one or if you or your employee are eligible for Medicaid. So that's something to look into. You may want to go to cms.gov to learn more information about what you can qualify for. And then from there, you'll kind of be directed to the sort of Medicaid office in your state to see if you're eligible for that, because Medicaid versus Medicare would be what does provide some of that coverage. Some people have long-term care insurance, maybe provided through their employer. If they have long-term care coverage through a plan that they may have purchased through their employer, that's another way to help with costs. And then there's just a number of other programs that may provide support and financial assistance. My recommendation is to go to eldercare.gov or eldercare.acl.gov. Do I have that right, Maggie? That is a great resource to provide that support on long-term care services in one's community, all the way sort of down to the county. There are local area agencies on aging in various counties across. And so this eldercare.acl.gov website is a great place to start, and put in that zip code and it'll point you to, social workers, case managers, your local AAA is what we call them, and who can provide help. Maggie, did you have anything to add to that?
I don't, but I did chat in that website so folks have easy access to it.
That's great. Thank you. It's a really good question. I'm going through the Q&As, Colin. I see one here. Someone is asking, provided that you have health insurance and work for a large employer, is there a penalty if you delay enrollment at age 65 and you decide to enroll under special enrollment when you are not getting work-related coverage? The short answer to that is no, you will not incur a penalty because of the fact that you're continuing to work and have your employer-based coverage past the age of 65. So you are okay. That's an exempt reason for you to delay your enrollment in, Part B, Part D. But think about, whether or not you want to enroll in Part A, because in most cases, Part A is probably already prepaid for you, depending on your work background. But in many cases, it is, and it's premium free. And so you wouldn't have to pay an additional penalty for that. But if you decide to delay Part B, continue with your employer-based plan, and then when you retire, you're going to end up losing your employer-based coverage, then that's when your special enrollment period kicks off. That's an 8-month window is what you'll have to be able to enroll in Medicare. I believe there's an even shorter window for Part D. So that's something we didn't cover. It's kind of in the details, but I think you have a shorter window to enroll in Part D after you lose your employer-based coverage. So I think it might be like 2 months instead of 8 months. So something to look at when you're enrolling. But the short answer is no, you would not have a penalty because that's an exempt reason is because you already have employer-based coverage working through a business, a company that has more than 20 people in your organization. I have another question. Is there a list of approved providers for Part C and D? I don't know if there's a list of approved providers per se. Whatever plan you enroll in is going to have their own network of providers. So yes, you're going to have a list of in-network approved providers, but it's going to depend on the plan that you enroll in and that you sign up for. You shop around for those types of plans and do your comparisons and do your due diligence to find what's the best plan for you. And I believe Medicare.gov has wonderful comparison tools where you can do that shopping around. There's a website called medicare.gov/find-a-plan. And that's where you can kind of shop around and compare apples to apples with different types of plans. And then once you decide and purchase a plan, I think is where you should certainly get a list of your in-network providers and who's in network. And it also helps to ask the provider that you're interested in going to. For example, if you want to stay with your current doctor and you're interested in a Medicare Advantage plan, a Part C plan, it's always a good thing to also ask on their side of things. Hey, I'm thinking of going to Medicare Advantage and joining that plan. Are you an in-network provider? Are you a participating provider for that plan? And that may make the decision for you if they are or not, because if they're out of network, there may be no coverage if you join that Part C plan. But if they are, then you may actually, have a lot of convenience there by sort of having everything all in one under that umbrella. There's a question about Medigap. Medigap is kind of a wraparound supplemental plan. It doesn't directly pay for any of the sort of medical services that, Part A, Part B, whatever covers. What it's going to do is help pay for your out-of-pocket costs. So things like your premiums, your deductibles, that's what Medigap pays for. And Medigap is, I think, another thing where you kind of shop around for. Medigap you cannot purchase if you have a Medicare Advantage plan. If you have a Part C plan, you can only get Medigap supplemental insurance if you go sort of the original Medicare route. Remember, those are the two main pathways to getting your Medicare coverage. You can either choose to go a la carte with original Medicare, which would be A, B, and D. You would shop around for Part D. And if you want, you would shop around for a MedSup or a Medigap plan. Those are things you shop around for that. If you go the other alternative pathway, which is Medicare Advantage, Part C, a lot of services are sort of under one umbrella. At minimum, they need to cover Part A and B. Most are going to cover Part D, but then you'll also may get some extras. Things like vision, dental. I've even seen things like nutrition coverage or fitness coverage or discounts. Some of those additional perks can come along with having a Medicare Advantage Part C plan. I think we're actually out of time. I don't know if there was anything else you wanted us to cover, Colin, but I just wanted to say thank you to everyone and for you for setting this up and Maggie for joining us.
No, I just thank you, Trisha. I know I wanted to put some of the contact information in places to learn more for any questions or any different pieces. But just thank you for the presentation today, and thank you, Maggie. I mean, it's just been so fantastic and informative. And again, we're looking for feedback, so folks could let us know what they thought about the webinar and the information presented. We'd love to hear that and see that. But we just appreciate everybody for the time today. Trisha, any kind of final thoughts or Maggie?
I'll go real quick. Just here's my contact information. If anyone's interested in signing up for a free workshop with your staff, happy to deliver a session on Medicare 101 to educate your staff on Medicare, whether or not they're turning 65, they may be caring for someone at home who is, and they're navigating Medicare on their behalf. So it could be useful to them. Happy to do that for you all. You can send me an email. We have our websites there as well, the Medicare enrollment guide. We also have our small business caregiving guide. We touched on Medicare caregiving a little bit today, and we have a plethora of caregiving resources. I also put a link in the chat for other workshops that we can provide to your company free of cost. All educational sessions to help your employee caregivers, but also anyone who's turning 65 or approaching retirement and are about to embark on Medicare enrollment decisions. So thanks for joining us from all over the country. And thanks to Maggie for you, as always, joining us in these sessions. Did you have anything to say?
No, just thank you all for having me. It was nice to be here today.
Great.
Wonderful. Well, thank you guys again, and thank you all for joining. And this is now officially the end of the webinar. Have a great rest of your day.